My name is Jamal Mansfield Jr., and I did ADHD. What is attention deficit hyperactivity? Attention deficit hyperactivity disorder, which is also known as ADHD, is one of the most common mental disorders affecting children to not focus on their attention span may be shortened. An estimated 8.4% of children and 2% of adults are diagnosed with ADHD. It is often identified in school-age children leading from 4 to 15. Some symptoms of this disorder are being difficulty focusing on or staying on task and being easily distracted. ABC symptoms, affective symptoms. There aren't a lot of affective emotional symptoms, but mainly people with it, for more intensity, can have trouble controlling themselves. People who have it can also feel irritated easily and with low tolerance or for stress or feeling anger. Behavioral symptoms. The behavioral symptoms are more common for example, if a kid or adult is having trouble standing still, they may fidget or move around a lot, even when they're supposed to be seated. They might talk more than others or interrupt conversation without meaning to, which turns into a behavioral issue because they cannot listen. Cognitive symptoms. This goes for people with a common thing of forgetfulness. This is mainly common in school, struggling with time management, often underestimating how long they can pull something off, putting things off into the last minute. It may be hard for them to hold information in their mind, which affects things like following direction or remembering details. The biological cause is strongly linked to genetics, so it is often around in families. Differences in brain structure and function, especially in areas that control attention, impulse control, and decision-making, also plays a part. There are also differences in brain chemicals like dopamine, which affects motivation and focus. Factors like premature birth, low birth weight, or exposure to substances like alcohol or nicotine before birth can increase this risk. The psychological cause involves how a person thinks and manages emotion. With ADHD, often there are weaker executive function skills like planning, organizing, and controlling impulses. They may also struggle with emotional regulation, which can be frustration or stress harder to handle and affect behavior over time. Social cause. The social cause in this environment, someone grows up and can influence how ADHD shows up. For example, high stress at home, inconsistent routines, lack of structure, or challenges at school can make symptoms more noticeable or harder to manage. Parenting style doesn't cause ADHD, but can support structure and expectations can affect how well someone copes with it. High risk. I did age group. ADHD is most commonly noticed in children between the ages of 6 and 12, because that's when school demands increase and symptoms like inattention and hyperactivity become more obvious. However, the signs don't start earlier. Signs may start often earlier, sometimes as a young age, preschool, ages around 3 to 5 years old. ADHD doesn't go away with age. Many people continue to have symptoms as teenagers and adults, though it may look different, like more trouble in focus, organization rather than hyperactivity. Biomedical treatment. Biomedical treatment for ADHD mainly focuses on medication that helps improve attention, control impulses, and reduce hyperactivity. The most common treatments are stimulant medications like Adderall or Ritalin, which work by increasing levels of brain chemicals such as dopamine and norepinephrine. These chemicals can help with focus, motivation, and self-control. Talk therapy. Talk therapy for ADHD focuses on helping someone understanding their behavior and better ways to manage it. A common type of cognitive behavioral therapy which helps people recognize unhelpful thought patterns and replace them more with realistic and productive ones. Can also teach practical skills like staying organized, managing time, and breaking tasks into smaller steps. So this basically means like taking therapy or like talking to somebody like a therapist about your condition. Active therapy. Active therapy for ADHD is actually doing things to manage the symptoms, not just talking about them. It focuses on building better habits and routines in everyday life. For example, someone might use a planner, set reminders, or break big tasks into smaller steps to stay on track. Here are my sources, and thank you.